So that's a great question. We get that question a lot. Some people want to know why they can't just do like a one and done. And the research shows, and basically what we're looking for in the research is response. So we want people to have an improvement or reduction in symptoms, and we want a prolonged period where symptoms are resolved, and that's known as remission. That's really what we're looking for. So we found was one session, some people responded, not all. By third session, more people responded. And then by the sixth session, we saw the majority responded, and then it had the most prolonged remission. Remission depends for many people, but typically we're trying to get those 6 sessions within about a 3 to 6 week period. And what the studies do show as well is that the results seem to be additive. And that's why we go with 6 sessions as the current standard. First, let's talk about the need for a booster. So what a booster would mean is that they're starting to see return of their symptoms. So they were in a remission period, perhaps they got their 6 sessions, and they're starting to see symptoms come back. It would probably be a good time for a booster. Highly individualized. This is not cookie cutter by any means. This is determined through the interaction with the clinician, but it really just depends. Some people, it could be 6 to 8 weeks later. Some people, it could be several months later. And again, it depends. Some people just need one booster periodically. Some people need a series, 2 to 3. It really just depends on the particular circumstance, the patient, and the symptoms. Typically, yes, but again, it just depends. It really just depends. Typically, ketamine is not a long-term treatment in itself. So it does typically require therapy. There's things we want to do in conjunction with the ketamine, but oftentimes people will feel they need a booster. Ketamine is an internal journey. So really, I think the most important thing is to prep the mind, prep the spirit, prep yourself emotionally. So keep the week light, keep your caffeine low, keep alcohol to a minimum, if not completely eliminated. Really just prepare yourself to surrender to the experience. Try and keep yourself open. I think those would be probably the biggest points. Light exercise, try and keep your stress and your sleep as a priority, and keeping them, well maintained. If someone's first doing ketamine, their initial experience, I probably wouldn't recommend throwing too many things at once. Maybe starting off simple. I'm a big fan in all of clinical medicine, starting simple, not making too many aggressive or extreme changes at a time. But sure, if that's something that they feel comforting, something that's been part of the practice, absolutely. Whatever can calm the nervous system, whatever can calm the mind, calm the spirit. I think integration is the most important aspect, and that's something I really stress a lot. I speak often that I believe at Within, we are an integration center that utilizes psychedelic medicine. I think that integration is first and foremost the most important aspect. And the way I like to describe it is the ketamine is going to open doors. It's going to open windows to within yourself, things that you might not be able to look at, you might not be able to address. You're going to get information, you're going to get awareness from that experience, but integration is a time period where you're going to take that awareness and you're going to start incorporating it into your life. And that's what creates change. The medicine itself doesn't create change. It's what you do with the awareness, the information, and the newfound information you get during that experience. That's what's going to create change. And that's what we're looking for. Yeah, I would say ketamine starts the engine. If we're talking about a vehicle, ketamine starts the car. It's gonna start bringing things in. It's gonna start things flowing. Things moving that perhaps, let's say it's a stagnant car. Let's say it's a vehicle sitting in the garage for a while. That might be a good one, right? We're gonna start it up. Ketamine is the key, and it's gonna start things flowing, moving, and that's really the analogy I would use. But integration that's everything. Let me tell you, if you go somewhere and they're talking about just medicine, no integration, run. That's really not clinically going to be relevant. Well, let's talk a little bit more about what ketamine does. So ketamine obviously does amazing things in the brain. One of the things it does is it creates neuroplasticity, which creates basically new pathways, new ways of operating within yourself. So integration is a way of unraveling, unwrapping, decoding, giving life verbally oftentimes to the things you experience. And by doing that, we start to make new connections within our lives. So it's really important. Integration is the key to change. The medicine is not the key to change. It's the unraveling, unpacking that happens during the integration process. It might be something as simple as the sense of flying, the sense of freedom. Perhaps someone who doesn't feel free within their body, within their lives, has a sensation of flying. that there's meaning there. It's not just a hallucination or an experience they're having. There's something there, and you can make connections. This is what a really good therapist or really good integration specialist will do. So it's making connections between the experience and things perhaps they're not seeing within themselves or within their life. So I think people know ketamine's right for them if they've tried other things and their symptoms are not improving. So unfortunately, especially when it comes to things like depression, the current Western medical pharmaceuticals don't create lasting change. They are very, very good at helping us cope. So if people are trying these medications, not seeing an improvement, not seeing prolonged remission, ketamine might be a great option, particularly for someone who wants to stay within the legal realm. You know, we have other options underground, but if they want to stay within the legal realm, ketamine is a wonderful, very effective option. I think if somebody is having, let's say, treatment-resistant depression, which means they've had trial of multiple medications, not seeing improvements, and they want improvements quickly. They want improvements now. They don't want to plan a trip to the jungle in 3 months, you know? Maybe they don't want to go to the jungle at all. Maybe they really want to keep it at home. They want to keep things comfortable because perhaps stepping out of that comfort is something that seems completely overwhelming. Ketamine works. We have ketamine. It's legal. It's extremely effective. We have research backing it. So it's a very beautiful, really effective option.